During a 4-day hospital stay, patients may interact with 50 different healthcare professionals. Since so many people are seeing the same patient, effective communication is necessary among the teams within a hospital. The more people that are involved, the more conversations that occur. If there isn't successful communication, this increases the chance of misinterpretation, resulting in medical errors. An estimated 80% of serious medical errors occur because of miscommunication among caregivers. So how do you communicate between staff to ensure that this doesn't happen? Hi everyone, I'm Matt from eTactics, and today I'm going to share ways to improve communication in your healthcare teams. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. First, you should identify all the current communication channels that your practice uses. This involves any systems that transmit patient data and critical practice information. Once you identify these, you can then determine the pros and cons for each. This helps you find any barriers of communication. You'll find that some methods will work better, while others are a little bit more challenging. Once you identify these challenges, though, you can then work to resolve them. Establishing effective communication starts with the culture in the workplace. Your staff needs to understand the value of exchanging information with each other. If you don't have a culture that promotes this, then staff won't expect it from others. Lower expectations leads to a lack of effort and poor performance. This is dangerous since it can lead to a lack of clarity and misinterpretation, thus causing medical errors. But emphasizing the importance of good communication sets the bar high and encourages staff to make the best efforts. Part of creating this culture is by giving everyone a voice. This reinforces that you value them and their opinions. It gives them more confidence to communicate with others. Ways you can do this are through surveys, one-on-one meetings, and staff meetings. Your surveys can even ask which communication methods they prefer. This helps with your process of assessing which services work. Group meetings are useful since not all coworkers are familiar with each other. Different departments and shifts means that some employees may never meet each other even if they work on the same patient. This makes it hard to communicate about a patient if staff don't even know who else is taking care of their patients. Next, find ways that technology can help. I already mentioned that certain tools are better or worse for sharing information. Different technologies have more useful capabilities geared toward your needs. For example, using mobile communication with HIPAA-compliant apps improves security and efficiency. Since health professionals are constantly moving around, they don't have time to check email or sit down at a computer system. If they can access patient information from anywhere in the facility with a mobile device, they'll save some time. And with HIPAA-compliant services, it ensures that patient data is secure. As you determine which technologies you use, you should aim to have a centralized system. Too many communication channels can be a burden if staff need to log in and check information on multiple systems. This could lead to inconsistency as well, or they may skip using the system altogether. Instead, streamline your channels with a centralized system so data is transmitted with minimal effort and time. Finally, prioritize face-to-face interaction. This requires minimal administrative work unlike electronic channels. It also decreases the chance for misinterpretation since you can talk to your coworkers in person and clarify any details. Poor communication in healthcare is harmful. It causes staff to expect less from each other. A culture of low expectation leads to imperfection and medical errors. But effective communication has positive outcomes. Staff can have more confidence in their work and save time with efficient, secure systems. And patients can feel better with changing staff if the health team communicates efficiently to provide quality care for one another. If you'd like to learn more about improving communication in your healthcare team, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.